For almost 50 years, aspiring hand surgeons have come through the doors of the Curtis Hand Center to experience firsthand the atmosphere and mission of our training program. The visit enables a candidate to get a sense of what it would be like to spend their most formative year at Curtis. We're going to attempt to give you a sense of the setting and the resources for a fellow in training through this visual tour. Welcome to the Curtis National Hand Center. As one of the largest hand surgical centers in the world, we play many roles. Our center is recognized as a hand surgery provider on both the regional and national level. At the state level, our center serves as the hand trauma provider for our Institute for Emergency Medical Services. And as our name implies, our center was literally built with congressionally designated support for the development of a national hand center. While we've always been known for our clinical care and excellence, our focus has always been and will always be on the education and training of hand surgery leaders for tomorrow. We often say that our fellowship is at the core of everything we do at Curtis. And this statement is reflected not only in the spirit of our center, but also in its design. Our fellows are housed in the heart of the action. Each have offices in the center core teaching and administrative suites. Here they have access to the clinical offices, the administrative offices, lecture halls, research suite, teleconference rooms, all the faculty offices, as well as our labs, including the cadaveric, microsurgical, and biomechanics lab. It also enables them rapid access to the operating room and emergency department. All of this is in the same building. So no time is wasted traveling between hospitals, driving to different satellites or ORs, or having to run across campus to the medical school cadaveric labs. We're going to highlight herein each of these resources. The newly renovated research suite is immediately adjacent to the fellows' offices, and here they have easy access to our research director, Dr. Gulati, as well as our clinical research consultant, Dr. Means. There's a myriad of different staff members here, including a program manager, research coordinator, biostatistician, bioinformaticist, and we're really proud to have our own full-time hand surgery editor. All of the staff is dedicated to making your time at Curtis as productive as possible from both a research standpoint as well as a clinical standpoint. Here you see our teleconference room and state-of-the-art digital conferencing centers. These are used on a daily basis. It's part of our robust curriculum that is entirely dedicated to the Hand Fellowship. A Hand Fellow is not just dipping into the curriculum of an overarching orthopedic or plastic surgery department. Our faculty are present and participating in the specific hand surgery curriculum. Our lecture halls overlook the mezzanine level at the Curtis Hand Therapy Unit. This is a tremendous resource of experienced hand therapists that participate in lectures, demonstrations, and share their clinical experience with our fellows, not only in the lecture halls, but in every clinic that they participate in. The McClinton Microsurgery Lab is one of the most valuable resources available for Curtis Fellows. The fully accredited animal lab utilizes a murine model for surgical survival studies. These studies are primarily microvascular and microneural. However, even more importantly is the surgical simulation using the femoral artery and vein as a beating heart simulation of digital revascularization. This is an important way for the hand fellow to gain confidence and experience in preparation for revascularization of digits and management of hand trauma. Our full-time microsurgical lab director is always available for head-to-head instruction. Our surgical skills lab is used daily for didactic cadaveric demonstrations, also for special skills labs such as flap courses, arthroplasty courses, arthroscopy simulation. It's often used for cadaveric research projects. The fellow can even use this resource on short notice for surgical rehearsal of challenging upcoming OR cases. Adjacent to the cadaver lab is our biomechanics research suite. This lab has a full-time director that can help build, design, plan, and execute studies involving fracture fixation, tendon repair, tendon transfers, and the like. This lab also includes a multitude of resources, including micro CT scanner, 3D printer, active motion tendon simulation devices, anything and everything you need for your biomechanics study. All of these incredible resources are a mere 3-minute walk from the fellows' offices. This is a critical part of both faculty, mentorship, and self-directed learning. Between cases and between clinics, these resources also provide an excellent setting for visiting speakers to spend time with our trainees.
These are a number of scripts written, right? There's a medicine here that will lower your blood pressure. There's a medicine here that may or may not lower your risk of cardiac disease. And then there's a medicine here which will diminish your pain. So who is getting these prescriptions?
So loss of endurance is another one to sort of pick up on. That they say, you know, it's like my hand gets tired after a while. It's like I can't do it.
We're kind of picking up where we were on our previous dissection when we exposed the TFCC. So historically, these have been done with silicone, and I think that probably is still the gold standard. And the Smith approach to the back of the hand was very common, but we tend to do this through a straight midline approach.
The way I see it is that if you've got the tendon coming down, I try and get in that angle. So right in the angle between where the tendon comes down to the bone and cut it along that plane, staying right there. The patient is an older patient and has a partial tear.
One of the biggest reasons that people come to train at the Curtis National Hand Center isn't because of our clinical volume, and it isn't because of their surgical independence. It isn't because of the depth and variety of our cases, and we have all of that. But I think the thing that is unique about our environment is the atmosphere that the faculty creates. When a fellow comes to our program, they feel like they are a partner. They don't feel like they are a trainee. They don't feel like they're a worker. They're joined into our family and treated as equals. This is a feeling that is new when you are a fellow. Throughout your training, you may have experienced being just the underling or just the trainee, but not someone with an important and considered opinion. Here you'll find it to be quite a bit different. Many years ago, I did my hand surgery fellowship here, and I came here to interview, and literally after an hour of sitting and meeting with the faculty and understanding the atmosphere and the sense of family and the camaraderie of the team, as well as the quality of the education, it became clear to me that this was my #1 choice of places to train. This is where I wanted to determine and to define my future as a hand surgeon. What I'm most proud of at the Hand Center here is the dedication of our faculty. There's 14 faculty members here, and this is an incredibly unique thing. They are all dedicated to the education of our hand fellows. This is not a fellowship program that is part of a larger orthopedic department or part of a larger plastic surgical department. We are focused solely and entirely on our hand fellowship program. The faculty spend their days, their nights, their weekends training these fellows, providing the skills and the capability to become the best that they can be. We are proud to have provided you with a snapshot of what we do here at the Curtis National Hand Center. But keep in mind, this is only a small part of a much larger story, a story that we hope includes you, making an impact on the future of hand surgery.